Sleep-wake disorders represent a diverse group of conditions that fundamentally disrupt the natural rhythm of human rest and wakefulness, affecting millions of people worldwide and significantly impacting their quality of life, cognitive function, and overall health. These disorders encompass a broad spectrum of conditions that interfere with the timing, quality, or duration of sleep, creating a cascade of consequences that extend far beyond simple fatigue. The intricate relationship between sleep and wakefulness is governed by complex neurobiological mechanisms, including circadian rhythms, homeostatic sleep drive, and various neurotransmitter systems that work in harmony to regulate our daily cycles of rest and activity. The classification of sleep-wake disorders has evolved significantly over the years, with modern diagnostic criteria recognizing several major categories that reflect the diverse nature of these conditions. Insomnia disorders, perhaps the most commonly recognized among sleep-wake disorders, are characterized by persistent difficulties in falling asleep, staying asleep, or experiencing restorative sleep despite adequate opportunity for rest. This condition affects approximately 30% of adults at some point in their lives, manifesting in various forms including acute insomnia triggered by stress or life changes and chronic insomnia that persists for months or years. The impact of insomnia extends beyond mere sleepiness, often leading to impaired concentration, mood disturbances, decreased productivity, and increased risk of accidents. Hypersomnia disorders represent another significant category within sleep-wake disorders, characterized by excessive daytime sleepiness despite adequate or even prolonged nighttime sleep. Narcolepsy, one of the most well-known hypersomnia disorders, involves sudden and uncontrollable episodes of sleep that can occur at inappropriate times and places. This condition often includes additional symptoms such as cataplexy, which involves sudden muscle weakness triggered by strong emotions, sleep paralysis, and hallucinations during sleep transitions. The unpredictable nature of narcoleptic episodes can severely impact an individual's ability to work, drive, or engage in normal daily activities, highlighting the profound social and occupational consequences of sleep-wake disorders. Circadian rhythm sleep-wake disorders occur when there is a misalignment between an individual's internal biological clock and the external environment or social expectations regarding sleep timing. These disorders can result from various factors including shift work, jet lag, delayed sleep phase syndrome, or advanced sleep phase syndrome. Shift work sleep disorder affects millions of workers who must remain awake during nighttime hours, disrupting their natural circadian rhythms and leading to chronic sleep deprivation, increased risk of accidents, and long-term health consequences, including cardiovascular disease and metabolic disorders. The growing prevalence of shift work in modern society has made this particular sleep-wake disorder increasingly relevant to public health discussions. Sleep-related breathing disorders, including obstructive sleep apnea and central sleep apnea, represent a critical subset of sleep-wake disorders that involve repeated interruptions in breathing during sleep. Obstructive sleep apnea, the most common form, occurs when the upper airway becomes blocked during sleep, leading to repeated awakening and fragmented sleep. This condition affects millions of people worldwide and is associated with serious health consequences including hypertension, cardiovascular disease, stroke, and diabetes. The loud snoring and gasping sounds associated with sleep apnea often affect not only the individual but also their bed partners, creating relationship stress and highlighting the social dimensions of sleep-wake disorders. Parasomnias constitute another fascinating category of sleep-wake disorders that involve abnormal behaviors, movements, emotions, or perceptions occurring during sleep or sleep-wake transitions. These conditions include sleepwalking, sleep terrors, nightmare disorder, and REM sleep behavior disorder, where individuals act out their dreams physically. Parasomnias can be particularly distressing for both patients and their families, as they often involve potentially dangerous behaviors performed while the individual is not fully conscious. Understanding these disorders requires careful evaluation of sleep architecture and the various stages of sleep during which these events occur. The diagnosis of sleep-wake disorders typically requires comprehensive evaluation, including detailed sleep history, sleep diaries, and often overnight sleep studies or polysomnography. These diagnostic tools allow healthcare providers to observe sleep patterns, breathing, brain activity, and movement during sleep, providing crucial information for accurate diagnosis and treatment planning. The complexity of sleep-wake disorders often requires multidisciplinary approaches involving sleep medicine specialists, neurologists, psychiatrists, and other healthcare professionals working together to address the various aspects of these conditions. Treatment approaches for sleep-wake disorders vary significantly depending on the specific condition and individual patient factors. Behavioral interventions, including sleep hygiene education and cognitive behavioral therapy for insomnia, have proven highly effective for many patients with sleep-wake disorders. These approaches focus on modifying behaviors and thought patterns that contribute to sleep difficulties, establishing consistent sleep schedules, and creating optimal sleep environments. Pharmacological treatments may also be necessary for certain sleep-wake disorders, including medications to promote sleep, maintain wakefulness, or address specific symptoms, such as cataplexy in narcolepsy. Medical devices play an important role in treating certain sleep-wake disorders, particularly sleep-related breathing disorders. Continuous positive airway pressure therapy remains the gold standard treatment for obstructive sleep apnea, providing a constant stream of air pressure to keep the airway open during sleep. Light therapy has proven effective for circadian rhythm sleep-wake disorders, helping to reset the biological clock and align sleep-wake cycles with desired schedules. The impact of sleep-wake disorders extends beyond individual health consequences to affect families, workplaces, and society as a whole. The economic burden of these disorders includes direct healthcare costs, lost productivity, and increased accident rates. Research has consistently demonstrated that untreated sleep-wake disorders contribute to increased healthcare utilization, higher rates of workplace injuries, and significant impairment in quality of life measures. Prevention and early intervention strategies for sleep-wake disorders focus on promoting healthy sleep habits, identifying risk factors, and addressing contributing conditions. Public health initiatives aimed at educating the general population about the importance of sleep and recognizing signs of sleep-wake disorders have become increasingly important as awareness of these conditions grows. The future of sleep-wake disorder research and treatment holds great promise, with advances in technology enabling better monitoring and treatment options. Wearable devices and smartphone applications are making it easier to track sleep patterns and identify potential problems, while telemedicine approaches are improving access to specialized care for individuals with sleep-wake disorders. Understanding the genetic, environmental, and lifestyle factors that contribute to these disorders continues to evolve, offering hope for more personalized and effective treatment approaches in the years to come.